All right, hello everybody for our Zoom call. It is, the wrong date on here. Sorry about that. It is, what is the date? It is the 1st of May, 2019. Today we're going to be talking about dealing with pain, and pain particularly to cancer pain and inflammation that it coincides with that. So that's what we want to discuss in our talk today. So as we move on here, there is multiple ways to deal with pain. Now, the first thing that the average person in the population does with pain is to take some pain medication. Now, these are hard pain medications here. These are strong pain medication, these narcotics, but most people, when they have a headache or they have a sore shoulder or they have some sort of pain, they're going to grab an over-the-counter Tylenol or Aleve or Naprosyn or something like that that's going to help decrease the pain and help them to continue on with life. And doing that once in a while is not necessarily a horrible thing, but that certainly doesn't want to be our first go-to. The first question that we should all ask when we have pain of any kind is, why do I have pain? So the why I have pain is an important thing to know because you want to deal with the reason why. So if I have pain, let's say I have breast cancer and I have pain at that cancer site, that might not be necessarily a bad thing. You could have a greater inflammatory response at that cancer site that's helping kill the cancer because an immune response to a site of any kind is going to be an inflammatory response. That's why we talk about not all inflammation is bad inflammation. So we don't necessarily want to just shut down inflammation and shut down pain when that inflammation could be an immune response that could be helping kill the cancer. So there's that balance of understanding why the pain is there and looking at that too. Doesn't mean that we want to just suffer through pain, but it does give us a different understanding that if I have a little bit of pain around a cancer site, well, and I can tolerate that, that might be a good thing to just tolerate. However, pain at, let's say I have colon cancer and I have really bad gut pain, it's not good to just kind of suffer through that as well. We don't ever want to get on the wrong side of pain, meaning that pain becomes uncontrollable and it's causing us to not be able to continue with our activities of daily living. But going to a strong narcotic might not be the best thing to do right off the bat. As a matter of fact, I don't think even someone who's pushing narcotics would say that that's the best thing to do right off the bat. We do want to look at some other alternate ways to deal with that pain um, once we discover why it's there and it's something that we want to diminish, other than jumping onto narcotics. One could say that if we're going to be on a narcotic, that could, be something that, too much of that could lead to our demise in itself. So we want to be careful in how we use narcotics. So some natural helps to pain are here as listed. Curcumin is a natural help to pain. That's a natural anti-inflammatory. It's a natural cancer killer. White willow bark is a very common thing you think of with dealing with pain, more so probably with joint pain than with pain in a organ, but it can still help. Quercetin is a benefit for pain. Boswellia is a benefit for pain, especially with intestinal inflammation and pain. Betalins are really good for pain. Betalins are found in beets. Bromelain, commonly found in pineapple, is good for pain. Other enzymes are good for pain. Rosemary is good for pain. CBD and THC, we've spoken about that at length in other Zoom calls. That is very good for pain. Ginger is good for pain. There's a lot of other things that I didn't list here also. Here's some in this little thing that I found online that can be good for different types of pain. But when we're talking about pain at a tumor site, we typically think of these types of nutrients to help limit pain. Now, some of these can work better for different people than other things too. Uh, I've had patients that didn't respond to curcumin at all and responded really well to high-dose boswellia or quercetin. Betalins, I've had people respond very well to betalins as well. And we're going to talk about a product that has specific betalins in it. And then enzymes, not just bromelain, but other enzymes in the Digestime Plus product that we have, and the Cleanzyme can be extremely beneficial for pain, and especially with reducing inflammation in the liver as well. Using, and one could just do a talk on this with just essential oils as well. Rosemary as an herb, taking orally or as an essential oil, can be extremely beneficial, and that's the same thing with ginger as well. Juicing ginger, whole ginger, cutting little slices of it off and juicing it can be extremely beneficial for pain. Of course, it can be hard on the tummy a little bit if you use too much of it, so be careful, but it can be really beneficial to decrease inflammation in the gut and decrease nausea. And then the THC CBD is probably the strongest natural pain relievers that is out there, especially for visceral pain in the organs. So using THC, we've had lots of people use CBD products for pain, or using marijuana, directly smoking marijuana is one of the better pain relieving things that a person can do, especially with visceral pain. This is the Clear Inflam product that we have that has curcumin, quercetin, boswellia, has stinging nettle, I think it has ginger and some rosemary. So this is a great one to help decrease inflammation locally. This Limitless product is one that's probably, we just talked about this in staff meeting today, probably one of our most underused products. That this company actually purchased the rights. There was a laboratory that discovered how to take betalins from beets without the sugar. So they actually have a patent on the way to process betalins without sugar. So they process the betalins out of the beets and give you straight betalins. That's what this product is. And if you have pain that you haven't been able to control with other natural means, I'd highly suggest you look at this on our site, because I've known people that were taking like 20 Advil a day to start taking this Limitless product and completely go off of that completely. So this could be really a life changer. There's lots and lots of testimonials on this product for pain and inflammation that are pretty cool. So look at that product itself too. Try a bunch of different essential oils. We could give you a list of different essential oils that are anti-inflammatory. You can also Google those essential oils that are anti-inflammatory and that can help with pain. I put rosemary on here, but literally there's dozens of them. Certainly try ginger and the CBD product that we have. The CBD product, we have two ones that I would say to use if pain is an issue. This Evolve Entourage, this new one that we have that I spoke about in a couple other videos, is so beneficial because it is water soluble, it's organic, and it's nanoparticled. So the absorbability of this is about 80 to 90% of what you take, versus any other CBD product out on the market. The absorbability and what actually gets into your bloodstream is only about 10% of what you take in. This premium hemp product here, the benefit of this is it's one of the very few super high dose CBD products on the market. This one in the upper right hand corner, if you can't see my cursor. That is super high dose. We've had numerous patients use that with much benefit with pain. I've used this with benefits with pain. This has been a good product. It comes out as a paste. It's in a syringe. It's hard to see because it's in a box here, but it comes out as a pretty thick paste, keep it in the refrigerator, and you take just, I was taking about a centimeter syringed out under my finger and take it. It doesn't have really much of a taste. Evolve Entourage has some benefits because it also has the immune product in it too. So you not only get the CBD, but you get the aloe benefits for cancer killing as well. So there's some hints to do with pain to try to stay away from these guys if you possibly can do so and reduce these. So if you're on any of the narcotic pain relievers, you do want to try to limit those as much as possible, but you don't want to do so at the expense of letting the pain get out of control. So I would suggest if you're taking these, you talk to your doctor about, well, at least start on some of these things, and then see and talk to your doctor about, boy, I feel like my pain's under control, I want to decrease the dosage, or you could make the choice to do that yourself, but I can't tell you to decrease your dosage of your medications. But at least consider that. All right, we are going to unmute everybody and open it up for questions. So anybody with any questions?
Dr. Connors, I have a couple questions.
Uh-huh.
This is Donna from Arkansas. How are you to really know if that pain is a good pain or a bad pain? You know, I don't have a tumor, so a lot of the things that I see on the market target tumors, but mine is more in the blood, multiple myeloma. But I've been experiencing pain for over a year. I don't take any narcotics at all. I just deal with it. I've been putting some CBD oil on it, but
so with a blood-borne cancer, it's a little bit different, but most of the pain from multiple myeloma is going to be due to the issue in the bone.
Yes.
So one of the issues with multiple myeloma is it could cause an osteoclastic, meaning a bone breakdown.
Okay.
And that's where you get the pain. So then you look at it a little bit different. All these things that we listed here would be beneficial for multiple myeloma because all these things would also target the bone. You'd also want to think of EGCG, green tea extract, for that as well.
Mm-hmm.
Yep, we have you on that.
Mm-hmm.
Because that is what is one of the very few products that are known to decrease interleukin-6, which is an inflammatory cytokine that is involved with bone breakdown. So make sure that, as a matter of fact, there's some new information on curcumin that can be involved in that same reaction to help decrease IL-6. And I'm trying to remember if it was ginger was a part of that too. There was another study, I'll have to pull that up. I was talking about some other things that could do that same thing. So all these things would pertain to you as well, because they would all be beneficial for bone. Yeah, you could equate all these to that.
Yeah, I take white willow for pain instead of aspirin.
Yeah.
And I take the CurcuClear Clear. I take those 3 a day.
Yeah.
But
so
I've tried
3 a day is for multiple myeloma. If you read some of the studies on multiple myeloma, that is one of the cancers that people are having greater success with really high dose curcumin.
So you think I should up it more than 3 a day?
You could triple that.
Oh, really?
Yeah.
Okay. Okay.
And you may want to also play with some different sources of the curcumin just for your benefit. Like you start learning some recipes to use turmeric in recipes.
Oh yeah, I've been doing that. Mm-hmm.
And make sure that they're recipes that contain a lot of other fats, so that they're like good, Indian food recipes that also contain a lot of coconut oil or something like that. That's what most of those recipes do.
Yeah.
That you get the benefit of it being absorbed in fat. That's going to increase your absorbability of that as well.
Correct. Okay. All right. I've been experimenting with, I just started with the SEX
Yeah.
and wanted to kind of get a feeling for you. Some people say that if you take it, it's actually absorbing and taking away all the minerals out of your body. Have you heard that?
No. Yeah, I mean, I've heard that, but that is total. It's just not correct.
Okay.
Because if you look at what's in Essiac are just several really good herbs,
Mm-hmm.
so
Mm-hmm.
it is not affecting your minerals in your body.
Okay.
There's
Yeah.
just no data to show that at all.
But it is a type of detox. Is that correct?
I would not say that. I would say,
Okay.
in a sense, because those same herbs are really good for liver.
Yeah.
So they are helping your liver detoxify. So
Yeah.
in that sense, yes. And I've had non-cancer patients take Essiac for that purpose.
Mm-hmm.
So it can be good for everybody. And if you're a non-cancer patient, I wouldn't say that you should take it all the time, but
Yeah.
doing a bottle every 3 months or something as a detox would be
Mm-hmm.
would be a wise thing to do.
Mm-hmm. Okay. All right. Yeah, I was a little bit concerned when they said, "Oh, that's going to strip all the minerals out of your body." I'm like, "Oh boy."
No, that
Okay.
doesn't do that.
Very good. Well, thank you. I hope your venture with your cancer is going well. We pray for you every single day.
Well, thank you. Thank you. I have good days and bad days. I'm
Yeah.
actually at home today doing the Zoom call. I left early because it was just
Uh-huh.
a little pooped out, but
Yeah, I understand that. Okay. Well, we're planning on coming up to see you sometime this summer. Just haven't
oh,
planned it yet.
I just, why you wouldn't come up in the winter? I just didn't understand.
Because I was born south of Chicago, and I know it's so.
Yeah.
Yeah.
Well,
That's why
it'll
I'm in
be great to see
Arkansas.
you. That's right. That's right.
Very good. Well, blessings to you, and thank you.
All right. Thank you, Donna. Any other questions today? Well, I'm encouraged to see that everybody is using the Facebook group more and more, and I hope that you're scrolling down and looking at other people's questions, because lots of times that answers your question. Somebody already had that question. And I do hope you're going to our YouTube channel and subscribing to that, because we have, I think, close to 400 videos on there if you really want to nerd out on different things. And those are all available to you as well. All right.
One question, if I could.
Sure. Yes.
Dr. Connors, I'm dealing with metastatic prostate cancer. John Kozad from Texas.
Yes. Hi,
And
John.
how you doing? And I've had doing really well. My PSA has come down from 100 to 7.7.
Well, that's really good news.
Wow.
So that's really good. Yes, sir. And then I had that liver enzyme tested 2 months ago. I think it's the ALT.
Yep. The ALT. Yep.
It was like 1,063. And
Yeah,
is
that's
that a
not good.
concern or?
So, did you have it tested again?
No, I have not.
Okay, so that's an inexpensive test for your doctor to run.
Okay.
So have them do your liver enzymes again
All right.
and see what's going on. I've had people with super high liver enzymes just because they're detoxing something,
Okay.
and then it goes back down to normal. And but if sustained high enzymes, you're concerned with what's going on in the liver.
Okay.
And if it's high again, they should do an ultrasound or a CT or an MRI of your liver to see what they see what's going on.
Okay.
That would be an appropriate thing to do.
All righty.
But it's super encouraging that your PSA is coming down. Hopefully your ALT will be back close to normal range too. Let me know right away when you get that test. I would call your doctor. Might be too late now, but I would call in the morning and just try to get in to get that test done.
Okay.
Because that's part of metabolic panel. you could ask for a liver enzyme panel too. That's the same thing.
Okay, will do.
Okay.
Thank you.
Wouldn't it help John if he were on some milk thistle? Because I know that helped bring mine down.
Yep, that would be. I don't have his chart in front of me, so I don't know what he's taking, but he's probably doing some. Knowing what we usually give everybody, he's probably doing some liver things. And John, I can look at your chart tomorrow to refresh myself to see what you're taking and call you back if we need to tweak something.
Okay. Thank you.
Oh, you sure, you bet, absolutely.
Also, if he's lost his gallbladder, I don't know if he has a gallbladder or not, John, but
I do. I have it. Yes.
okay, that's good because the ox bile has really helped me since I don't have a gallbladder anymore.
Okay.
Yeah.
Thank you.
All right. Well, we will talk to you guys next week. Thanks
Okay.
for being on here.
Welcome. Bye.
Very good. Thank you so much.
Oh, you bet.
Bye-bye.
Bye-bye.
Bye.